Good morning. I would like to present this case series on retinal artery macroaneurysm and the various treatment modalities which was undergone. So coming to the introduction of retinal artery macroaneurysm, it was coined by Robertson in 1973. So basically, retinal artery macroaneurysm defines as the focal dilatation of the retinal arterioles ranging from 100 to 250 micrometers, usually affecting the first three orders of bifurcations and at the AV crossing points, affecting mainly the supratemporal arcades and infratemporal arcades. And based on their presentations, the RAM can be hemorrhagic, quiescent or exudative. And 2/3 of patients usually will have a history of hypertension. There are various theories for pathogenesis of retinal artery macroaneurysms. It can be due to the weakness in the muscularis layer which develops leading to aneurysmal dilatations. So coming to this case series, we have seen 4 cases who presented to the OPD. We evaluated them with vision and regular ophthalmologic examinations, out of which the 3 patients who had macroaneurysms and the exudations near the macula and the supratemporal quadrants were underwent panretinal photocoagulation were followed up, and 1 patient who had a lesion which was away from the macula nasal to the wrist with normal vision, and we were advised for conservative management and followed up. So this is the case profile of the 4 cases. Most of the patients were above the age of 65 years with a history of hypertension, and the fundus fundus examination was performed to reveal the features of aneurysmal dilated arterioles and the exudation, and the fundus fluorescein angiography was also performed for the 3 cases. So coming to the case 1, we did on the fundus photograph, we can see then the supratemporal involvement with the hemorrhage and the exudation, with fundus fluorescein angiography revealing the same aneurysmal dilatation as hyperfluorescent areas with focal areas of leak near the macula. And this is case 2. Actually, the patient had presented with vitreous hemorrhage, and upon resolving of the hemorrhage, we could get this fundus image, and again there is a supratemporal arteriole involvement mainly at the crossing point, and again in the fluorescein angiography we were able to see the dilated vessel. And this is case 3. This patient actually didn't have much visual complaints, and we could make out this supratemporal quadrant involvement. And the case 4 also, it was an incidental finding. The patient on screening had this aneurysmal dilatation nasal to the disc with some amount of exudation, and the OCT was performed to reveal the dilation. And the cases 1 to 3 we had advised for panretinal photocoagulation, and on follow-up there was a resolution of the hemorrhage and exudation as seen in the image. In the case 2 also, like post resolution of the VH, we had done laser photocoagulation in case 3 also. So among the 3 patients there was an improvement in the hemorrhages and exudation post laser, and in the last case we followed them up, and there was no deterioration or any hemorrhage which increased, so the patient was also stable with their vision. So there is no standard treatment guidelines as of now for retinal artery macroaneurysm. It's mainly based on the position level of the macroaneurysm. Previous studies mostly suggest it's a self-resolving course. Non-surgical management is generally preferred, and laser photocoagulation itself has some complications related to it, so its use is actually restricted. And anti-VEGF agents has proven in cases of huge amounts of exudation and edema to resolve the symptoms related to vision, and OCTA has been a newer diagnostic modality which has been used. So in conclusion, based on the level of the retinal artery macroaneurysm, the distance from the fovea, other factors which affect with the prognosis, and the different treatment imaging modalities will help, and we have to tailor based on each patient whatever treatment is required. And these are my references. Thank you.
Well, Well presented, Dr. Karthik. Any questions from the
You
panel?
mentioned that you did pan-retinal photocoagulation. Was it pan-retinal photocoagulation or something else?
We did
Focal to aneurysm was done. That was mentioned. You said multiple modalities of treatment, but you mentioned only focal to aneurysm. Did you give anti-VEGF?
No, we didn't give any anti-VEGF for these patients. We give after the sitting of laser only. The patient had improvement in their vision, and on follow-up also the vision remained stable. So
Your title says different treatment modalities. You have given only focal to aneurysm.
and conservative management, like
What conservative management you given?
no, we just like to follow up if there is any rupture of hemorrhage and all, the patient can present with later stages with diminution of vision. So
What you mean by conservative treatment? What kind of treatment?
like
In one patient you have given, you mentioned in your presentation. In your presentation, you mentioned that in 2 patients you have given laser, and 1 patient was managed with conservative treatment. So what conservative treatment you have given?
we are not
So it's usually in few cases of RAM, you really don't need to do much because they can self-regress also. All you need is a good
they
control
can
of their
undergo
hypertension.
thrombosis
Yes,
and
yeah.
self
And
So it's
most
the
important is
management of
hypertension control.
hypertension control.
That is most important.